Thanks for staying on. It's still GTV Breakfast live on GTV. I'm Thelma Taki. Welcome. We're doing a second batch of the BFS clinic. This time we are talking World Antibiotics Awareness Week. It's a global initiative aimed at promoting awareness about the responsible use of antibiotics and addressing the growing threat of antibiotic resistance. We are told that that's a very big problem. And at the table this morning, Madam Anita Iyasamwa, MPH, is a public health epidemiologist, and she's in the studio to help us understand what this Antibiotics Resistance Week is all about. So Antibiotics Awareness Week is what you call it. What's an epidemiologist doing raising awareness about antibiotics?
Okay, so it's all about disease control. So being an epidemiologist and a public health advocate, it's all intertwined. We have to do this awareness. I have to create this awareness for people to know it is not just only me. It is a body. I'm a member of the British Society of Antimicrobial Chemotherapy, and we are doing this globally today, for a week. We started on the 18th, which was on Saturday, then it ends on the 24th. So creating awareness basically about antimicrobial resistance, which is something that is eating nations up, because when resistance sets in, as we go along, I'll explain what it is. When resistance sets in infections, or when you have an infection, it is a big issue. That's what we call the superbugs, the fungi, the parasites, the bacteria. The common antibiotics we take wouldn't be able to kill them or have effect on them.
When does this become a problem? And what you wanted to explain it to us now.
Okay.
When we talk about antibiotics, it's meant for you to take for a certain condition. If you have a wound and we want to prevent infections of those nature, then you're prescribed an antibiotic.
Exactly.
When does it become a problem?
Okay, it becomes a problem when people, maybe I went to see a doctor, the doctor gave me a prescription yesterday, and maybe next month, maybe the infection reoccurs, or maybe I feel sick again. But instead of maybe going back to the clinic or the hospital, for the doctor to test again to see if maybe I am having another bacterial infection, or maybe fungi infection, or maybe whatever infection it is, I just go to the chemist or the pharmacy to get the same drugs the doctor prescribed for me, just because I have the prescription list. It is misuse and abuse. So you get it. So the misuse and the abuse of these antibiotics is what is bringing about the antimicrobial resistance. Now, resistance sets in because you've been abusing it. When you would need these antibiotics, they are not going to be effective against this bacteria. And that is when we say that a resistant strain of maybe tuberculosis are setting. That's if for maybe people living with TB. So we have resistant strains of all this fungi, bacteria, parasites, and virus. So we have to be really careful how we misuse, how we use antibiotics. You follow the rules. If the doctor tells you take it 8 hourly, maybe 6 hourly, 5 hours, you follow that exactly. And you don't go and repeat the doses by yourself. Also, you don't, maybe because maybe you have a runny tummy at home, somebody has Flagyl, what we call metronidazole, then you just go and then the person gives you, Misuse, the acne.
That it works.
Oh, no,
and
but
that's
you don't.
The danger, isn't it?
It has the, yes. Because you don't even know maybe the expiry date on what you're taking. You don't know the condition that affected that same person that is giving it to you, for the doctor to have written that maybe prescription for him or her, and then you just take it because you feel, Flagyl, the runny tummy.
Is it a problem generally with how we treat medications that has, transcended to the antibiotic space? Because we are just used to passing it on. So if the child is not well and we gave them medication A, then if the next child is not well with what we presume would be the same condition, we just pass on the medication. And it's exactly what
leftover medication.
Antibiotics.
Yes, that is it. So it's not just the antibiotics, just like you said. Even the painkiller, the analgesics. People abuse paracetamol. Now it is Gibidol. People are abusing Gibidol.
You can abuse paracetamol.
Of course. So I have a headache today. I didn't even go to the hospital to check. Maybe it is even my BP that is giving me a signal. You don't even know. Maybe something is knocking on your door. You don't even go check anything. You just go and buy Gibidol. You take. The body pain immediately goes away. Your kidneys, your liver. Today, you know how the kidney, place in Kolebu is. Yes. Apart from that, the paracetamol, it can cause tingling in your ear, what we call tinnitus. It will be as if there's noise in your ear. That's misusing it over a long period of time, but people don't know. So it is not just the antibiotics. Medications generally, there are what we call contraindications. If you are using a medication, maybe you're on, like for instance, maybe you have a herbal product at home you're taking, and then you go and buy an antibiotic or any other medication, even your normal BP or diabetic medication, and then you mix it up. I took my herbal drink and I took the normal medication. There's what we call contraindication. It can occur and you may die within seconds because chemical reactions would happen within you. If it is a doctor or a pharmacy that gave it to you, sometimes they will tell you that take this 1 hour before you eat, or don't take it with milk because it may coagulate. Take this one with water, or maybe after you eat, or wait 30 minutes before you eat, then you take it. But we don't follow all those things.
Are important.
Yeah, very, very important. Very, very important.
For those restrictions.
Very, very important.
What if you forget a dose? Because chances are, if you're taking it for 5 to 7 days, as the doctors prescribe, one of the days you may forget that, I was supposed to take it at 7 o'clock. What happens when you remember that
so
you've missed?
in that case, when you skip one, you just take the next. Don't take double dose of, maybe I skipped this morning 6 a.m. Now I'm supposed to take at maybe 10 a.m. Then I'll say, okay, because I skipped 6 a.m., I'm going to mix, add the 6 a.m. one to the 10 a.m. one. No, you just take the 10 a.m. one. If you don't understand anything, go back to the hospital or the pharmacist to give it to you. And that is why we want people to get medications from pharmacists who have a pharmacist on board, like present at every duty, or at least maybe a nurse. In that way, if there are contraindications or whatever drugs that shouldn't be mixed together, they would be able to tell you that no, don't take this and this, take this first before. Because
not everybody you meet at the pharmacy when you go to buy drugs is a pharmacist.
No, not everybody. We have the pharmacy assistants, we have the pharmacy technologists, though they've been trained, but then sometimes the scientific reactions and stuff like that, the chemical reactions, they may not really be able to know except the pharmacist.
So antibiotic resistance is a huge challenge, and this week
it is a huge challenge.
You are trying to raise awareness.
Yes.
What tools are available for you to use? Obviously, there's a platform like this that we can have conversations on. How else are you reaching people? Okay,
so for the society in general, and Africa CDC, we have programs lined up. People can join from online on Twitter, on Facebook. The links are there. But on in my own capacity,
share the handles with us.
Yes, in my own capacity, I do that on my own pages on social media. Anita Iya Samoa, telling people not to misuse antibiotics. And even yesterday, I was telling women that if you are always treating infections, sexually transmitted infections, even as a married woman, you have to be careful, because most times we have the women coming to the clinic, going to the clinic without the husbands for infections. You are being treated on antibiotics every time. It's not going to help, because maybe your husband is maybe doing something else somewhere. It is a chain reaction. You all have to come to the clinic for the treatment. If not, you will keep treating, and when resistance sets in, you can develop other serious issues as a woman. So, not just women alone, as a man also. And that is why you have to stick to one faithful sexual partner, because it is a chain reaction. HIV, AIDS, and stuff like that, gonorrhea, resistant strain of gonorrhea abound. So if you're not careful and you misuse these things, it's going to have effect on you. Remember your kidney, your liver, your general well-being is very important. So we have to be careful. So don't buy antibiotics on your own, at your own will. That is one. Don't use any leftover medication from anybody.
The societies have their own names for antibiotics, and without even naming names, we can mention the Abon belt and
the red and yellow.
So explain to us in those terms so that our people at home will understand the kind of
I don't know what they call it in Ghana, but in Twi Tupaye, or Shukru, yeah. I think Tupaye and Oshukru.
Some antibiotics.
Yeah, oh yes.
Tetracycline.
Flagyl, flagyl that most people know, flagyl, tetracycline, and stuff like that.
What's the worst that could happen? You become resistant to these drugs.
Yes.
It means what?
It means that when you would need this particular medications, when you have an infection worrying you, it may not be effective.
And they can't
because
the
bacteria, the fungi, whatever is causing it, has become resistant, has gone back and developed itself a new strain, and it has come back stronger. Just like COVID, that we had new strains every time you get it. So they come back stronger than they were before. Just like you and I, because we are passing through life's problems and troubles, we become stronger by the day. You get it? Sometimes some people fall by the way, some of us go on. So that is how it is. So if you're not careful, and this bacteria, parasites, and all this parasites or whatever get resistance, it's going to be a problem.
We are wrapping this up. So what information do you want people to take away from this? It's World Antibiotics Awareness Week, and you are telling us, you're giving us some tips on how to use antibiotics safely.
Yes.
Tell us what those are.
Okay, so don't self-medicate on antibiotics. Not just only antibiotics, and not just painkillers, paracetamol, Gibidol. I'm particular about Gibidol because
why is that,
everybody keeps buying Gibidol.
Okay, what does it do? What kind of medication?
Oh, it's a pain relief.
It's a pain relief.
Yeah, people take it when they have cold. Oh, they just go and then just buy it. Some even take it continuously for 2 weeks. It's not good. You don't take painkillers like that. At most 3 days, 5 days. That's why the doctor will tell you, after 3 days you've taken paracetamol and nothing, come to the clinic. Even when you have malaria, you get it for your temperature to combat temperature. You have to go to the hospital, even with the children.
But people are abusing this.
Exactly. Your kidney, please always remember that your kidney are very important. Your liver is very important. And also, don't pass on any of your medications, whatever medication it is, except maybe items in a first aid box which you just need for first aid before maybe you transport the person to the hospital. Aside that, you don't have to give anybody any medication. And for infections, I'm particular about the sexual infections because it is very common. A lot of people are not faithful to their partners. They have multiple partners, and it is a problem. Infections occur. Some people women will tell you, oh, toilet infection. Sometimes it is not toilet infection. Sometimes it is the people you're sleeping without protection. If care is not taken, it can cause infertility, even in a man. And as a woman, if PID sets in, then that is granted. Pelvic inflammatory disease.
Okay.
So for that's for women, and when that sets in, it will be very difficult to conceive if care is not taken.
You are going to share some handles with us. We are talking awareness, and this whole week you'll be very busy. I'm sure people would like to follow and listen into some of your conversations. How can they reach you? Okay,
so you can reach me on Anita E. Asamoah, Facebook, Instagram, Twitter, LinkedIn. Just when you type in Anita space E space Asamoah, I am there. And please, the hashtag is WAAW 2023. That's World Antimicrobial Resistance Week for 2023. Also, I think I would like to can I go on my own personal, use this avenue to say that we at Medrex Pharmacy, we also operate 24 hours, and you can always walk in or just call us and then buy your medications instead of just self-medicating. Yes.
Because now the platforms are there for you to reach professionals via the power of social media and telephones, so they can give you expert advice. It's World Antibiotics Awareness Week. The call is on all of us to stop abusing medications generally, but more specifically antibiotics, because of the risk of developing resistance to diseases when you most need it. Of course, the effect on your kidneys and liver and other important body organs can also not be underestimated. Madam Anita E. Asamoah is a public health epidemiologist, and she is an advocate for this week we are marking World Antibiotics Awareness Week. Anita, thank you for sitting with us today.
Thank you very
and we
much
wish you
for
well
having me
in this advocacy as you go into the week and all your
so
activities.
you also do it, share with people. We are all doing this together. We are all in it to stop resistance in Ghana.
Thank you, Anita. And that's how we wrap this segment. Multi-Sider Sadiq was standing by to bring us the sports news.